We've developed drafts of the national policy over time, about 10 years now, and every time we go to review, we are given different copies which we feel the industry went behind and denatured. They pull out important messages and push in theirs. That's what we suspect.
South Africa, there's quite a huge presence. The industry is quite huge, and at the moment they're actually opposing the move to pass, policies. So they are very engaged in how, civil society advocacy groups are actually pushing and asking government to actually pass the laws, because that is how we'll protect young people from harmful use of alcohol.
It's been fairly negative. A lot of what we've done has been based around modelling, so looking at the potential effects of policies rather than evaluating policies that have actually been implemented. And we've had a lot of attacks on whether that even counts as evidence.
You know that the alcohol industry in Vietnam has been growing very fast recently. Before it was totally government-owned, but after the privatization, it became like a private and public business, and many new companies founded.
So there's one quite famous quote that people like to talk about of an industry spokesman who said, there's evidence, there's research, and then there's modelling. And you end up in this strange world where a huge scientific project suddenly becomes not research. And so we've had huge amounts of attacks on that, attacks on the credibility of the work, attacks on the scientific detail from scientists who've been funded by the industry to attack it, and then also just attacks on the basic principles behind the work as well.
About the lessons learned with tobacco, that the process of negotiating a tobacco treaty, we learned that the most important obstacle to achieving policies that are effective at the population level is the industry interference. So that was a very important learning part of the process, that we really need to manage conflict of interest very seriously if we want to advance with public health. And that goes for tobacco, for alcohol, and for food.
I think that it makes very big challenge to public health in Vietnam, because the number of drinking increased very fast, and also prevalence of drinking grow very fast, but also the consumption of alcohol per capita also growing very fast during just for very short period of time.
So the alcohol industry have been very clever about how they've couched their opposition to alcohol minimum pricing. So first of all, the opposition has been fronted by the Scotch Whisky Association, with all the iconic status of whisky in Scotland, but actually really it's been about the interests of those global producers like Diageo, Pernod Ricard and Suntory Beam, who are producing an awful lot of vodka that is getting consumed in Scotland.
The companies who are bankrolling the Scotch Whisky Association, mainly Diageo, are producers of cheap supermarket vodkas, and these are exactly the products which the people who have got the most problems with alcohol, the poorest people in our society as well, they're the products that they are drinking.
And they've tried to say that this policy won't work, that it's based on erroneous research, but actually the reality is there's an extremely well evidenced reason to think that this will save lives and reduce misery in Scotland.
This has never been anything to do with Scotch whisky. Scotch whisky has been used as a front for the actions of these global producers who are peddling cheap booze to poor people with problems.
And at the same time, the level of knowledge of the policymaker, government officer about the danger to join with alcohol industry and let them to interfere to public health policy still limited. And that's why they have a freedom to participate and interfere to many policy process. For example, right now Vietnam is preparing for new alcohol control.
Because we go to review and we are given different drafts. drafts, copies of the drafts which we don't own. So that's how we feel about the industry. And hearing from what we've had in this conference, that it's a common experience everywhere, we are not very much surprised.
Alcohol policies that are impacted on by these agreements range from those that are talking about access, for example, the number of outlets, the hours and so on, labelling, disclosure of content, reduction of alcohol levels, through to control of Facebook and social media, advertising, sponsorship and so on. Almost everything you could think of.
Industry is invited to listen to comment on the provision and make recommendation to the government. So that is very big issue in the country, I think.
Yeah, one key issue has to do with the industry trying to, get to be regarded as a stakeholder. Almost all the meetings, they've tried their best to get access to the meetings and sit with us, and that is actually that conflicts with our focus, because we don't believe that the alcohol industry is a stakeholder, and we don't believe that they should get involved in the public health policy making, specifically on alcohol issues. So that has been one of the key issues they're trying to get involved. And per our intelligence, it's like they are very close with the policy makers.
Talking about links between unhealthy commodity producers. We're so used to thinking about the alcohol industry as being separate from the tobacco industry and separate from the ultra-processed food industry, when really there are very close structural links and also serious strategic similarities across those industries, and I think that they have important implications for the development of effective health policies at national and particularly international levels.
So there's a concerted push to develop new global rules that will prevent governments in the future from being able to regulate the activities of the alcohol industry and many other industries for the foreseeable future.
I presented information from the International Alcohol Control Study, looking at consumption in 10 very different countries, high-income countries, middle-income countries, very different levels of drinking there. But what we were able to show was that very significant proportions of the alcohol consumed in all of those countries was drunk in harmful drinking occasions.
It's very worrying, partly the actual presence in the room. So while there's very clear rules that the tobacco industry is to be excluded, the UN high-level meeting on NCDs in New York in 2011 included very high levels of representation from the alcohol industry and from the leading food transnationals. So there's a problem of presence and a problem of participation.
And the point of this is to look at what it means for the alcohol industry. The point is that if they were really concerned about alcohol-related harm and did work in partnership collaboratively with governments to reduce harm, this would be very significant effect on their sales and their profits.
And I think that actually what we've also done in the course of that is we've changed the public sense of the Scotch whisky industry as being, this wonderful part of Scottish culture, to recognising that it's actually an industry that's actually controlled by multinational conglomerates who are not interested in culture or history or anything to do with Scotland. They're just interested in maximising profits for big business.
But crucially, there's an issue around taking conflict of interest seriously in developing health policies. That I think this is the key lesson to take from the tobacco control experience. Basically, taking conflict of interest seriously underpins everything about tobacco control from national and international levels. And yet, international agencies find it very difficult to engage with this issue.
And I think that really underpins why the industry, in fact, works against any effective alcohol policy and is only prepared to put up much less effective approaches.
One of my presentation actually focused on the activities of Guinness Ghana Limited, which is a subsidiary of Diageo, and their activities within the educational sector, trying to influence the young people, especially the students within the school, on what they call the smart drinking.
Well, SAPA picked up the release of a campaign in the media actually, where SAB tried to portray that it's okay to sell alcohol to feed people.
The most worrying sign is that the industry is adopting this strategy of responsible drinking and then penetrating into educational institutes, especially tertiary institutions.
To be honest, if you look at many websites of the leading alcohol transnationals, you would think you were looking at development agencies, and they're very heavily branded with the various ways in which they see their products and their conduct as promoting sustainable development.
The claim that it's possible, it outraged us actually, that they could think that you can sell beer to feed people.
This is where our concern is, because affecting the young people when they're not really that conversant with the harms of alcohol is really worrying.
It just doesn't stack up. The alcohol industry is a major impediment to progress on all sorts of fronts, and I think one of the challenges for alcohol researchers and advocates is to develop an evidence base and to develop strategies to convince policymakers nationally and internationally of the enormous contribution that taking alcohol control seriously can have in accelerating development across a number of fronts.
Their working is in such a way that one, they have come up with strategies where their investment is very much focusing on the issue of using the local resources, meaning the raw materials which initially they used to import is now being produced locally.
Guinness is involved in so many activities in Ghana, even in terms of infrastructure development, trying to get in there. They're also trying to get into the road safety. You know, these are areas that we are trying to counter them, to get them out of it.
They were trying to find another way to access the market, that already in South Africa they dominate many aspects of our lives.
They are getting in touch with the Ghana Education Service, trying to get closer to the regulators, to the educational, some of the academics, to see how they can influence. But even interestingly, I mean, the University of Ghana, I think, was part of this program that they are running, which is something weird to us that we think is something that they shouldn't do.
And also the other thing they are doing is that they are working with traditional leaders and the policymakers to make sure that they continue investing.
That the development sector does need resources. We've got limited resources, so that is an issue. And I think that they were checking what is it that they would be able to get away with in the public field.
I think as far as the government is concerned, they realize the importance of legislating, prohibiting the sale of alcohol to minors, this under 18 in off-premise sales. But this publicity strategy of the industry, I guess we need to warrant more concern from the government side, from the policymakers' side.
And then we decided that we needed to take them on.
Let's see, I presented on the state of the research on the influence of alcohol marketing on young people's drinking.
So I presented on a research study we did in South Africa, 2 communities that looked at alcohol availability and marketing to young people. This was part of the STRIVE project that we're doing in Tanzania, South Africa, and India.
Package and label of alcoholic beverages has become more and more important because it can be used as the marketing tool to communicate with the customer at the point of sale or at the during the drinking of the customer. So it is become an important marketing tool.
And so the industry do not have laws and policies which are there to guard against the industry from irresponsible advertising, marketing. So you find that the industry has been able to penetrate most of the events, get them sports events, music shows, campaigns. They are ever promoting their alcohol.
So we noticed that a number of alcohol products in Australia seem to address health, at least to some extent. So we looked into it a little bit further, and we found that alcohol company executives identified health and wellness as a major trend affecting the industry, but also as a major kind of opportunity for the industry to innovate and grow the sector.
Because our country has been very lax in terms of alcohol regulation, and so the industry has found it very easy for them to be able to do whatever the work they want to do, and be able to even target their children, especially who are the future generation of our country, Uganda.
So what we found was young people in both rural and urban communities are heavily exposed to alcohol in terms of outlet density when you look at the proximity to alcohol outlets to schools.
So the main finding is young people prefer these types of alcohol which is packaged in these alcohol sachets because it's cheaper, it's accessible, they can buy it anywhere, but also it facilitates drinking even in class.
And we did an environmental scan of one of the areas in our slum areas in Kampala, and we found that we almost had 500 adverts in just 500-meter radius of a given locality. And the adverts you're talking about advertisements in terms of billboards, outdoor advertisements, you're talking about advertisements of small flyers on shops, in bars, we're talking about advertisements in terms of capes, in terms of t-shirts, in terms of all things that the industry can use to be able to advertise and reach out and get their message across.
So essentially, our research is exploring alcohol use among young people, and the industry really is now targeting young people in developing countries, especially in Africa, because they see it as an emerging market.
At this point, there are at least 25 longitudinal studies that have followed groups of young people over time and found that the more young people are exposed to alcohol marketing in various forms, the more likely they are to start drinking, or if they're already drinking, to drink more. The effect sizes are particularly large in that latter category. The more they're exposed, the more likely they are to be moving on to binge and hazardous drinking.
So for policymakers, we need, what my study highlights is we really need policies that will protect the vulnerable groups, especially young people. And really, I think what we need is to have to address issues that are operated at the macro levels, so marketing, production of alcohol, availability, pricing.
This is a problem because research from the food and tobacco industries shows that, consumers who see products promoted as healthful tend to drink more of the product or consume more of the product, as they may believe that there are fewer health consequences associated with them.
They're really within a 500-meter radius, and the law in South Africa says they shouldn't be. So there's issues of lack of compliance, lack of policing. So young people are easily able to get alcohol. And there's also billboards, there's posters outside of the outlets themselves. So this is where young people, get to see different products being advertised, and then they want to try them.
So we need to strengthen capacity of the public health sector to be effective in communicating with the trade people to ensure that we can minimize the undue impacts of the influence of trade policy on the public health.
To make sure that the industry is not around the table, we need to make sure that they are not part of the solution when they are actually creating the problem. And we need to spread that news around to politicians, and we need to give them clear recommendations on how to avoid conflict of interest. And
we have DEFENSA. It is a framework for engagement with non-state actors for WHO. and we have to use the good parts of it. We have to make sure that WHO is implementing it and are very concerned about the conflict of interest of the alcohol industry.
I think we need kind of mechanism or international instrument to help increase the coherence between trade and health policy.
The implication for the policymakers is that we have to be aware that the alcohol industry will continue their investment. We have to be vigilant.
So our research really contributes to the evidence that we need to address alcohol use among young people and really have strategies to counter the industry's strategies so that we can protect this vulnerable group.
At the same time, we have to make sure that we put in place policies and the regulatory framework that we will ensure that we do not only have these policies in place, but also we implement to make sure that we safeguard and protect the interests of the public.
It's really important that people in the alcohol control community are not afraid of the notion of engaging with trade and investment agreements. They sound terribly arcane and complex, but they're impacting on everyday decisions about alcohol policy within every country.
And I think FENSA could be used as a tool for keeping the alcohol industry at arm's length from policy making in the alcohol policy field.
I think we've got to rapidly increase our understanding of the alcohol industry. We've got a really nascent literature. I think it's beginning to grow in important ways, but it's an area where it's still very difficult to get research funders to engage. But an event like GAPSI can be really important in accelerating awareness of these kind of issues and in recognising that the alcohol industry isn't just a research topic in and of itself. It underpins all important areas of alcohol policy from health and development perspectives.